Hi, this is Dr. Kevin Shaw at Sound Holistic Health Clinic in Everett, Washington. And we're here today to talk about integrative wound care and how we can help people with that at our clinic. So I'm going to be introducing someone in a minute, but first I want to talk a little bit about the combination we do here is a combination of integrative evidence-based medicine where we're using traditional wound care treatments and bandaging techniques and combining that with some newer techniques that we have to enhance circulation, especially microcirculation, because microcirculation is very important for wound healing. We have evidence that if there's oxygen levels that are low in the skin immediately around a wound, that it is not going to heal properly until that gets restored. So we really have to work on microcirculation for that. And we do have a device here that we use in the clinic which helps to stimulate that. We also have some other techniques like acupuncture that we use for that as well. And then we have different applications that we can use, different internal and external additives that we can give to people that can help them with increasing cell turnover and tissue regeneration, getting more granulation into the wound. So that's the type of different things that we offer, trying to combine the best of all worlds and do it with using the latest information from a number of different areas with the conventional wound care treatments. I would like at this time then to introduce Wendy Thomason, who is a nurse that's working here with us in the clinic and is a wound care specialist. So welcome, Wendy.
Thank you.
It's great to have you here. So I was going to ask you if you could tell people a little bit about your experience in wound care.
Okay. My experience in wound care started a long time ago. I came out of high school and went with an immunization team to Nicaragua.
Mm-hmm.
And it was primarily immunizations, but it
Right.
was also some basic wound care.
Okay.
And from there, I went on to the military where I repaired medical equipment.
Okay.
And that's where I made the decision to go into nursing. So I got
Right.
out of the
Okay.
military and then went to the University of Washington and got
Mm-hmm.
my bachelor's in nursing
Uh-huh.
and worked with Providence Home Health and Hospice for almost 21 years.
Wow.
And there was a lot of wound care, not just terminal wound care, but
Mm-hmm.
also some rehab wound care, post-op type wound
Sure.
care. And then, of course, you can imagine there's a lot of work that you do with chronic wounds in
Uh-huh.
that type of setting.
Absolutely.
And that was in residential, home services, and
Mm-hmm.
also in acute care.
Nice.
And then I went on to get my master's degree
Mm-hmm.
and
Great.
in nursing leadership
Mm-hmm.
and management. And my favorite of all of my years of nursing, which is now right around 30 years,
Mm-hmm.
is wound care.
Oh.
I love wound
Great.
care.
Right. So we're happy to have someone that's that excited about it here. And I did want to mention too that we are talking more, as Wendy mentioned, about chronic wound care. So we are not an urgent care clinic that's working on trauma that just happened a second ago. So if you do get injured, please go to our neighbors nearby, Swedish and Providence, and go to the emergency department, urgent care, and get taken care of. But then even with an acute wound like that, we can still help it to heal faster once you've been stitched up or surgery taped or whatever, all the different glued, all the different techniques people use these days. But we just don't want people, walking in our front door with gunshot wounds here. We're not set up for that here. So, but we do really want to help people that have had either they really want to accelerate the healing of their wound, to get the pain down, to get the scarring minimized. That's another thing we really can work on here. Or if people have had these wounds that are not healing for a long period of time, then they need some extra help with that, and that's what we can provide them. So. So I understand, Wendy, you also have a certification in wound care as well, right?
Yes. With Wound Ostomy Continence Nursing Certification Board.
Oh, okay, great, excellent. So yeah, we like that, and the fact that you have a graduate degree in nursing, you're a very well educated individual, and I've gotten to work with you on a couple of people and see how we can really work on these wounds together, and it's come out really well. Um, so you told us about your education, which is great. One of the other things I wanted to ask you about today was like, you said you really liked wound care, and it's one of your favorite things of all. So what is it about wound care that really gets you excited?
I think it might be, it's just very rewarding because there's a visual reward,
Mm-hmm.
right? And it's also a puzzle,
Mm-hmm.
because you've got this wound that's clearly a problem and very distressing to most people.
Right.
And you're able to kind of put the puzzle pieces together and figure out what's going on in the
Mm-hmm.
whole person
Right.
that's affecting this wound that's not healing. And then, of course, the reward of helping that to heal
Right.
is fun for me.
Great. Yeah. So there are definitely a lot of aspects to wound healing, right? I
Mm-hmm.
mean, someone has to have the right nutrition going on to heal well,
Mm-hmm.
for example, and it is also, I would say, it is a kind of thing that is very gratifying to me as well because you can see what's happening, where we can help someone's um, intestinal mucosa to heal, but we don't directly see it very easily,
Yeah.
right? Without a lot of specialized testing and equipment. Whereas with the wound, you can just sit there and look at it and go, oh, look, it's filling in nicely. The edges are coming in and opposing each other really well. And it's just day by day, you can see things happening, and that's really rewarding.
Which is especially exciting for somebody who's had to deal with a chronic wound and
Mm-hmm.
hasn't had
Right.
good results.
Sure. I
So,
would say it's been our experience with our patients as well, is that we have had them be very excited when they see things are starting to change
mm-hmm.
and they're no longer having a lot of difficulty with just maintaining where they were or getting worse. We're able to get them forward progress in a much shorter period of time than was happening before.
Yes.
Okay,
Yes.
great. So I think I asked you the general questions I would ask you, so I just wanted to see, is there anything else you wanted to mention to people about what you like to work with, or anything else about yourself you think they should know?
Oh gosh, I think that I really appreciate one thing I appreciate about working here is the team
Mm-hmm.
approach,
Right.
which is really nice. Having a lot of people with different specialties when you're looking at a whole person, it's nice
Right.
to have everybody's different perspectives.
Yeah. Okay. Great. And
Appreciate
that's
that.
yeah, and that's one of the reasons why I started this clinic in the first place, was so that we could have a lot of different members of a team that all had different expertise to work together and have people be able to have someone they had the right rapport with and have different tools that could help them,
Yes.
because it's different than just going to one person in one office and then going to another person in another office. When we can all work together here as a team, I think we can get really good results for people. And we've got a lot of talented people here, which we'll be talking with more of them as we go forward. So I just wanted to mention that a little bit here. So next week on Wednesday, we're going to try to continue our new series here on educating people more about the different things we offer here at the clinic and hopefully getting them more help. So next Wednesday, Jim Burr, who's another acupuncturist here at the clinic, who's been doing a lot of extra training in a technique called neuroacupuncture to work on specifically neurological conditions. He has been getting a lot of this extra training, and we're seeing some good results with his patients with this type of new technique. And we're going to talk to him next Wednesday, February 27th at 12:30 around lunchtime. So hopefully people can actually see things that are going on here. Also upcoming, we're going to talk to different other practitioners here in the clinic. I'm going to do some discussions of some different types of therapies we do here. Also, some of the newer dietary strategies we're working with people on that have really helped some of our patients with their blood sugar issues. It's been incredible seeing people going from the 200s down to the 70s on their fasting blood sugars in a very short period of time. And also, we'll also provide some information on some different events that we're going to be doing related to all of the above. So I think that's about it for today. I want to thank you again, Wendy, for being here with us and helping us to discuss a little bit about what we can do here with wound care. And I'm sure that you're looking forward to seeing people here in the clinic and getting to work with them again. So give us a call if you want to schedule a consultation and see what we can do to help you. And we'll get something like that set up. We are credentialed with most major insurers, although always we ask people to talk to their carrier because there are so many different plans that it's hard for us to know exactly what your plan is. But generally, we work with a lot of different insurers. So that's it for today. I really want to thank you for joining us here at Sound Holistic Health Clinic, and we look forward to bringing you more useful information. All right, thank you.